One of the most fascinating and tragic facts about lung cancer is that it often begins silently, progressing unnoticed until it's already in advanced, too late stage. Nearly 70% of lung cancer are diagnosed when they are no longer curable, no longer operable, making it one of the deadliest cancers worldwide. Pathophysiologically, lung cancer is not just a single disease, my beloveds. It broadly divided into non-small cell lung cancer, which accounts for about 85% of all cases, and small lung cancer, which is more aggressively, of course, and tightly linked to smoking. What's interesting is that even among non-smokers, mutations in specific oncogenes such as EGFR, ALK, or ROS1 can drive tumor growth, and these have become actually targets for precision target therapies. From a cellular perspective, chronic exposure to carcinogens like tobacco smoke leads to DNA damage and mutations in tumor suppressor genes like p53 and oncogenes like CRAS. Over time, these changes cause uncontrolled proliferation, angiogenesis, and eventually metastasis, most often to the brain, liver, or bones. Clinically, the symptom can be deceptively mild at first. That is, chronic cough, mild dyspnea, or fatigue. That's why even experienced clinicians can miss early disease, making screening with low-dose computer tomography scans a lifesaver for higher-risk patients, especially smokers over 50. So quit smoking. Period. Anyway, from exam standpoint, always remember, main risk factor, smoking. Doesn't matter what type of smoking, active, passive, etc. Most common type overall is adenocarcinoma. Third point, paraneoplastic syndromes such as SIDH, hypercalcemia, and Lambert-Eaton myasthenic syndrome, are key diagnostic clues. And definitive diagnosis always by biopsy and histological examination, if it's possible. So the most interesting fact is this: lung cancer tells a story not only of an environmental damage, but also a molecular precision. Once a uniformly absolutely fatal disease is now one where targeted therapy and immunotherapy are giving patients hope for survival. Okay? Stay blessed.